I'm meeting today with Ken Roach. He's a licensed clinical mental health counselor. And before we get into what you're going to discuss with me today, Ken, would you give those who would like to talk to you later or make contact with you your contact information?
Sure. So I have offices in Pleasant Grove and in Holiday. And my direct line is 801-792-7028, and I am seeing new clients. Thank you.
Excellent. What are we talking about today?
Well, so today I wanted to talk about parenting a child who has attention deficit hyperactivity disorder. Sometimes people just call that ADD, although the real term is ADHD.
All right. Now, this is particularly important because it can be hard enough in a tranquil marriage to deal with a child like that, but when there's stress in the marriage or a divorce, oftentimes that can exacerbate the stress on the family, or it can exacerbate the symptoms or the behavior of the child with ADHD.
Mm-hmm.
So tell us a little bit about some of the things you've seen in any family setting, both a divorce or divorcing family or an intact family.
Mm-hmm. So one of the challenges with kids with ADHD is that these are kids who generally need a lot of structure, who need a lot of follow-through, who need a lot of patience. So that makes it a challenge for all parents involved. So typically what we see is parents who get impatient working with their kid. That's understandable. Because kids generally need a lot of reminders, again, a lot of follow-through, immediate rewards, immediate consequences, and frankly, that's a pretty tiring way to parent. It's hard work.
Is it possible to manage a child out of ADHD by, for example, saying, well, I'll quit my job and I'll be a stay-at-home parent, and the other parent can be the one whose income we live off of?
So I would say generally no, that these are chronic conditions.
So you can forgive yourself now. That's why I was asking that question.
Having said that even though they're chronic conditions, that they're manageable. Specifically, ADHD is very manageable, and there are a number of approaches that have been shown to be effective. So medication is helpful for some kids. I think there's some hesitation on the part of parents to seek medication because we don't want to over-medicate our kids. And there is truth to the fact that all medications have side effects. So parents are sometimes reticent to explore that option with their children. On the flip side, and one of the motivations or one of the reasons to seek a medical consultation is that kids who don't get proper medication are actually at higher risk to abuse illicit drugs. One of the things I'll say from clinical experience is that kids with ADHD tend to resort to using marijuana. Marijuana seems to be the drug of choice for kids with ADHD. It just kind of regulates them in a way that's very, very appealing. I'm not saying it's appealing to the parents. I'm not saying it's a desirable solution. I'm just saying that it seems to be something that kids turn to, seems to be the solution that they find.
If I were to ask you if a desirable solution to ADHD self-medicating is marijuana, what would you say?
I would say no.
Now, the reason I ask that clearly is because right now, at the time that we make this, there's a lot of discussion about medical marijuana, especially just on the heels of the Utah legislative session,
right,
where that came up.
Right.
So, again, we're not trying to get into a political morass here, but your feeling is that that's probably not necessary for a child dealing with ADHD. Not appropriate. Would that be accurate? That
would be entirely accurate. And so thank you for clarifying. I am not endorsing the use of illicit drugs, let alone marijuana, and I actually think that illicit drug use for children is always inappropriate, always, always, always. I'm simply saying that marijuana seems to be the drug that kids turn to, resort to.
Kids who do get access to it tend to like it, whether it's good for them or not.
Exactly.
All right, and that's interesting that you would say, because let's face it, there are a lot of parents who think that there's a new medication coming out every day. We see it we're watching television and we find all these new things, and that we have conditions we didn't even know existed.
Right.
And there apparently is a drug to treat each one of those conditions. But that's interesting that you would say that not treating a child who might respond well to medication may actually expose that child to abusing drugs. I assume, what about alcohol? Is alcohol something that ADHD sufferers, whatever term you want to use, sufferers or people with ADHD, is that something that kids will often turn to?
As well, I would say those are the two drugs, but also those are the two, we would sometimes call them gateway drugs. So those tend to be the drugs that kids experiment with if they're going to be, if that's going to be eventually a problem. Illicit drug use, that is.
Now, I'm not going to say these questions are essentially mine, but I know that I think I speak for many people watching this. What about drugs that turn my child into a psychotic? I don't want to treat my child for ADHD. It'll make him or her psychotic.
Well, I just want to say that raises my eyebrows because there are no drugs that are designed to do that. I'm not a physician, but I've seen many, many, many children and adults who have been medicated appropriately, and not a single drug is designed to make someone psychotic. They're all designed to alleviate symptoms.
Not designed to make a child psychotic, but hey, that's one of the nasty side effects. Is that true? There's a lot of parents that worry.
No.
Okay. Here's another question. You talked about there's nothing that doesn't have side effects. So what are some of the worst side effects of medication? And then let's talk about the more mild, maybe not even noticeable or subtle side effects. So what are, in your experience, what are the most common bad side effects?
So again, one of the challenges is that I'm not a physician, but I can tell you just from having read the literature and seen children. So with the stimulant medications for attention deficit hyperactivity disorder, the most common drug being things like Ritalin, Concerta, that these medications sometimes stunt growth in children. So children who take them for long periods of time may end up shorter than children who don't take these medications. There are other non-stimulant medications that sometimes work for kids, and they do not have the same side effects. But a quick comment that most of the challenges that we see with kids who are taking medications actually have to do with not having the right medication prescribed or doses that are off. So usually that takes some work with the prescribing physician to manage the medications appropriately. When medications are managed appropriately, side effects can usually be minimized.
What are some of the kind of unusual benefits of ADHD, whether treated or untreated, if you've seen that?
So one of the aspects or characteristics of people with ADHD is they tend to be more playful, spontaneous, humorous, creative, and so there are a lot of gifts that go along with ADHD. It's just that when we're parenting someone with ADHD, we want them to obey, be compliant, do well in school, that we don't always want to see the side that's creative, fun, spontaneous, playful. We want them just go to school and do what you're supposed to do.
So does that mean that the ADHD children may want to consider an online schooling, homeschooling, or dropping out of high school and getting a GED, but instead developing that talent for welding or sculpting or coding? Or do you see what I'm saying? I mean, these are things that a lot of, like you say, if you haven't grown up with ADHD or lived with it yourself, I think it's fair to say that some parents would say, I never experienced this, so I just want to stick my square peg ADHD kid in this round hole, no matter what it takes. So what are some things that may take a little courage, or maybe thinking outside the box for the benefit of this child, so that this child will be as quote unquote normal as possible without being just crushed mentally and emotionally?
Right.
Follow what I'm saying?
Yeah. So I think there's a lot of variability in how kids respond to this. Some kids would not do well sitting in front of a computer screen, so an online program for them might not be the best option. Others are very distracted in the classroom. They might need a smaller classroom or other accommodations. So in cases of severe ADHD, it's appropriate to approach the school to ask about making accommodations for that particular child's learning
I don't know.
style.
Can you get IEPs for ADHD?
Yes.
Okay.
Yes,
and
you can.
Tell them what an IEP is for the people that don't know, please.
So that's an individualized education plan, and I'm not sure I have the acronym exactly right, but it's close to that. That is an accommodation that the school is required under federal law to make for the child to accommodate each child's learning needs.
What else can be done for a child with ADHD other than the medication side of things? We talked quite a bit about that, which I'm glad we did. What are some of the other things that either are done in the alternative or done combined with medication?
Well, so I'll talk about things that people can do at home as parents, to come back to that. So the one that comes to mind for me, I talked a lot about structure. So examples of that would be to be very concrete with a child. So in other words, tell the child exactly what the expectations are. So Johnny, I want you to clean your room right now. What I mean by that is pick up all your things. To avoid long strings of instructions, and after you're done with your room, then take out the trash and then do the floor. So one thing at a time, or small numbers of things. Repeated check-ins with the child, follow-ups. Don't do rewards and punishments that are way off in the future. A bad example of how to parent an ADHD child would be to say, Johnny, if you get, I'm always using Johnny as my example, Sally, if you get all A's, we'll give you $5 for every A. That's at the end of the term, or we'll give you that puppy that you've always wanted. That's not going to work. The end of the school year is basically 50 years off to an ADHD child. So instead, something where you can give immediate notice, immediate recognition. So maybe have a chart with stars on it to indicate you did well in school today, or you did well in school this week, with some kind of reward or recognition system at the end of each week.
Is there any more intensive therapy or treatment that ADHD children need if they're not severe?
So I would say most of what we focus on is parenting and help parents have the patience and the skills to follow through. As kids get older and they become more aware of what it is to have ADHD, kids can also benefit from therapy and adjust their own learning, and also be able to cope with the disorder so that they can manage in school themselves.
So most of the time that you spend is with parents then? Is it with parents and children, or just the parents?
It's a combination. As kids get older, I try to include the kids more, but when the kids are younger, then I think it's appropriate to focus primarily on the parents.
You talked about kids getting older then, so how long are we talking a course of treatment?
So for parents who pick up the skills quickly, I think this can usually be a few sessions. Sometimes kids who have more extreme symptoms, or perhaps there are other challenges in the family. Let's say we're working with a parent who has 5 children, one has autism, one has oppositional defiant disorder, and one has attention deficit disorder, where parents are stretched really thin like that, it can be quite a challenge to appropriately parent all of the children.
So are you talking something where do we usually see ADHD manifest itself? At what age?
So again, there's a variety on that, but usually it becomes most noticeable in school, because that's the setting where we have an expectation that kids are going to sit still for long periods of time. People don't usually get too upset when a 3-year-old is jumping around, is hyperactive, moving around a lot, there's some accommodation or expectation that children are going to do that. But by first and second grade, if a kid is getting up out of his or her seat, turning off lights in the classroom, being disruptive, that's where it gets to be more problematic.
And at what point would someone in your position say, my work is done here?
So I would say the goal for me would be, and generally for families, is that a kid is doing reasonably well in school, at home, and at home. So that means that they're doing their homework assignments, they're remembering to turn them in. As an aside, that's another challenge with ADHD. Some kids do their homework assignments just fine, and then they forget to take them to school, or they leave them in their backpack. So there really is a certain amount of training for the child that can be helpful to help the child focus, remember, give the kid reminders on how to do things well. So, but when the kid is doing reasonably well, the child, I keep saying kid, the child is doing reasonably well in school and at home, doing the chores most of the time and so on, that would be a goal that I think most parents would have.
On average, what can a parent who's really trying and taking the advice of a professional, how long can that parent expect this to take, on average, knowing that everyone's unique, not holding you to anything?
Right, yeah. I would say usually a couple months.
Wow.
Yeah.
All right. Well, what can people expect to be paying for something like this?
So fees vary, and of course it depends on insurance, but I would say most therapists charge in the range of $80 to $100 an hour, sometimes $110 an hour.
All right. Well, thank you so much, and thanks for being so candid with us about this. Before we end again, for people that would like to speak to you again or see what services you may offer, could you give them your contact information?
Sure. Again, it's Ken Roach, and my phone number is 801-792-7028.
Thanks so much.
Thank you.